Hi, Dr. Haydon, Austin Plastic Surgery Institute. Going to talk a little bit today about the drooping eyelids, or what sometimes you'll hear people refer to as an eyelid lift. Upper lids, there are some people who just have heaviness of the skin that causes the eyelid to sort of be pushed down. And when that skin is removed, it takes away some of the weight and it brings the eyelid margin up now. The eye becomes more youthful looking and kind of pops a little bit. There are some people that do have some brow descent, and you kind of have to address that separately with a little incision up here and do like a temporal brow lift. But most of the time, people can just have that small portion of skin removed. Sometimes you'll see people that have crow's feet. In all honesty, crow's feet is best responds to something like Botox, Dysport, or some sort of toxin in there. Sometimes they'll have excess skin, and everyone is kind of a little bit different. For the upper blepharoplasty, all of us do it a very similar way. In other words, we design it so that the excess skin is removed, and when that skin is taken out and the closure is done, it's really well hidden up in the sulcus so that you don't really ever see it. But the nice thing again is that everything kind of moves up with it. Probably of all the things we do, upper blepharoplasty is the thing that makes the biggest impact, the earliest, and has the most long-term success. With the lower blepharoplasty, we kind of have two approaches. One is to make a small incision just below the lash line, and the other is to make it on the inside part of the eyelid. But going inside the eyelid is really for teasing some of that extra fat out, whereas going on the outside is for people that have a lot of skin excess. Lastly, the biggest benefit in the lower eyelid, tear trough, and cheek malar area is the addition of fat. So in other words, I can take fat from another part of the body and just put tiny little amounts in that area, and that really helps take away from those dark circles and that loss of volume that we always get. So most everyone in the first, 1 to 4 days is going to have some moderate swelling, maybe some bruising, maybe a little bit of blurry vision. After that, you've just got a little bit, bruising, particularly on the sides and under the eyes. Usually at the end of about the first week, the majority of that is gone. By the end of 2 weeks, almost everything can be covered up with makeup. Both really, pretty standard procedures that we do. And if your eyelids have been bothering you and you really want to discuss if this is an option for you, then give us a call and we can make a plan for you. So just a couple of quick examples. This is a lady actually in her late 60s, has a lot of redundancy of the upper lid, pushing everything down. Once that's taken out, now you can see how you can just see more of the upper eyelid. In some of our patients, they say that they've gotten to the point where they can't even put eyeshadow on because they have to lift their skin up so much. You got that lateral hooding, and just with the blepharoplasty, I did not do a brow lift on her, but you can see how much more of that upper lid you can see, and therefore then how her eyelid pops. Another example, a little bit younger patient, but still had kind of premature excess skin. Just taking away that excess really lifted her up, and you can see particularly on her oblique here how much more of her eye exposed. Again, these are procedures that can be done, very minimal downtime, and really get a very impactful both short-term and then long-term result as well.